Hi, my name is Rachel, and I'm here today to present my patient, my older patient, whom I think is not doing well. So this is my client, she's a 78-year-old female who has been attending counseling sessions because of she has grief and loss issues after losing her only sibling, her sister, and her only child in a space of 3 months. The client lives alone because she lost her husband many years ago. She has a granddaughter and has 2 friends as support. Last month, the client was diagnosed with ovarian cancer and she feels devastated. After 3 weeks of counseling, she has not been able to cope with her diagnosis and she's still traumatized about her grief. Her mind is always preoccupied with death and she has not been able to accept the undergo treatment despite the counseling. She was prescribed Prozac for her depression, and to treat the client, regular monitoring will be performed until the clients reach her goal. Prozac 20 mg PO will be continued for depression, and she will be encouraged to attend activities with her friends. It is observed in the later session that patients is not reflecting appropriate outcome as I was expected. The patient is severely depressed and she lost all her hopes and does not take her medications even for days. Another challenge that affected the outcome of the counseling was that I would find myself adjusting communication style, and this made the client uncomfortable. For instance, sometimes I will find myself unknowingly changing my communication styles in accordance with the beliefs I hold regarding older persons, instead of focusing on her trait. This will make the client uncomfortable, and as soon as I notice it, I try to change. So person-centered therapy was used during all counseling sessions where a holistic approach was adopted. Every attempt was made to promote a setting that enabled the client to encounter herself and interact more with her thoughts, feelings, as well as meanings. The effectiveness of this therapy is that enables individuals to have a stronger personality and understands their feelings. This helps people to find a meaning in life through self-actualization. So it was difficult to build trust with the client. The client kept on asking about my experience in counseling practice, and this indicated that she will be more trustful with a counselor who is more experienced. The lack of trust might impact the clinical outcomes because evidence shows that the elderly tend to accept the advice of professionals they perceive to have adequate experience and competency. In addition to lack of trust, her inability to cope effectively with her losses prevents her from eliminating the negative thoughts. So I decided to reach out to her granddaughter so she can take her to an inpatient psychiatry unit where she can receive intensive therapy and be monitored closely. Thank you.